Welcome back to Paramedic Project. Thanks for joining us once again. Today, joining me once again, Dr. Fran Williamson, emergency physician, plenty of pre-hospital experience dealing with the traumatised patient. And today, thought we'd just break down some of the specifics around the actual management items that we do to these traumatised patients. So, what's your experience? The big ticket management items. Let's talk about them.
Well, obviously, traumatic cardiac arrest is a very different pathophysiology from a medical cardiac arrest, and so our focus and our priorities needs to be completely different.
Sure.
So I think we need to initially think about what causes the arrest, and it's either going to be an oxygenation or a volume problem, and so that's where we need to focus our attention.
Okay. So oxygenation first of all. What are the actual management items?
Yeah. So we don't need to focus too much on actually intubating, because obviously that's a time skill that will take away a whole team member. But good application of oxygen, clearing the airway, the use of a Gadella and LMA can attend to that.
Okay. And oxygenation, ventilation wise?
Yeah, so obviously other than oxygenation, the next big thing that puts people into traumatic cardiac arrest is an obstructive cause. So our number one here is a tension pneumothorax.
Yeah. So we're not talking about an obstructed airway here, we're actually talking about a circulatory obstruction.
Yeah. And so our focus here is either, if I'm on scene, to do a surgical decompression with thoracostomies bilaterally,
Yes.
or otherwise needle decompression bilaterally if you don't have the technique.
And that's kind of the set play. If we've got a tension pneumothorax on scene, then bilateral
decompression.
Yeah, bilateral decompression if the patient's in traumatic cardiac arrest.
Yeah.
Yep. Okay, and then the other one we talked about was circulation.
Yeah, and I think this is the biggest item where people go wrong. They get very focused on the airway and the breathing, and they forget about C, which is really important in these patients.
Yeah, because that I suppose that needle decompression for a lot of paramedics out there, it's a really new skill. It's something they don't have a lot of experience doing, and so it is easy to get task focused doing those new skills and trying to get them perfect when you're doing them, which I suppose then kind of drags their attention away from some other big things. So why is circulation so important, or how does it go wrong in your experience?
Yeah, so I think we need to get back to basics and we need to do what we do well.
Okay.
Part of that is not forgetting these big items, not getting task focused away from them. So things that I don't see done well is people forget binders and splints.
Okay,
That's
so pelvic
probably
binders and just any type of splint or any splinting at all, people forget to do that.
Yeah, so remember that you can lose a lot of volume into your femur. So if you've got bilateral femoral fractures and a pelvic fracture, you've already lost probably your circulating volume.
Sure. Okay.
So we need to get a pelvic binder on really early. We need to pull femurs to length, and you don't actually need to apply formal splinting if you don't have the hands or the time, but getting a bystander to hold those legs out to length will buy you time in this scenario.
Sure. Making
sure we've got good IV access. If we can't get access early, then getting an IO in straight away.
Yep. And
then giving a volume bolus.
Okay. So that's a big take-home point by the sounds. Patients in traumatic cardiac arrest, often these real basics, our kind of basic paramedic skills, splinting, the bread and butter doesn't get done really well, and they're really, really important. I mean, if these patients have got a big external hemorrhage, it's really easy to see that, and we're going to go and we're going to fix that external hemorrhage, or at least try and stop the hemorrhage. But I suppose with long bone fractures, especially femoral fractures and pelvic fractures, they're a little bit more covert. It's a little bit more difficult to see them, and we've got to get back to our bread and butter. And that's in your experience where a lot of crews fall down in care of these patients.
I think people get very task focused, and they also succumb to a bit of their own adrenaline.
Yep.
And they just forget A, B's and C's.
All right. So A, B's and C's, get back to basics. Been Paramedic Project. Thanks for joining us once again. Join us next time. We'll see you soon.